Thank you, Mr. Speaker. The lines talk about, line 6 talks about regularly providing training. Could the good chairman elaborate on this regularly, or is it left to every hospital to decide how regularly, how often they want to provide? Or are we saying that you do need to do this frequently? Through you, Mr. Speaker, if the good chairman could expand on regularly. Through you, Mr. Speaker.
Representative Serra.
Thank you, Mr. Speaker. Mr. Speaker, according to my notes here, the Department of Public Health evaluates the public health and safety of Connecticut residents in part through hospital licensure inspection. DPH also works with federal healthcare financial administration to ensure compliance with federal standards, which also includes routine inspection to help monitor the quality of care. Under the bill, all hospitals will be required to incorporate training into symptoms of dementia into regularly provided training for direct care staff so that the attending physicians could direct treatment and follow-up care accordingly. So based on that, we also, this legislature voted a Alzheimer task force, and I had already enumerated on that. And the reason we're asking for this is probably to curtail some of the leading higher costs and longer lengths of stay and poor outcomes for older residents with dementia. So that's why this is being required, and that the Aging Committee voted unanimously to require the staff members of hospitals. The training will be depending on the type of hospital, but we are going to require training to recognize dementia by hospital staff people.
Representative Srinivasan.
Through you, Mr. Speaker, am I then to understand that we as a legislature or the Department of Public Health is not mandating the hospital to have these training sessions, and that we are leaving it up to the hospitals and the level of service that they provide, that they can decide, the hospital can decide what they feel is the right amount of regularly held training sessions? Through you, Mr. Speaker.
Representative Serra.
That is correct. It depends on the level of hospital care and the level of the hospital as to how they handle patients. But yes, this legislature, if this bill passes, is requiring hospitals at different levels to at least have some training in this area for their staff.
Representative Srinivasan.
Through you, Mr. Speaker, then we are not saying here that Hospital A has to have these training sessions 2 times a year. Hospital B, because of the kind of patients they take care of, need to do it more frequently, 4 times a year. We are leaving that to the hospitals to decide as to how often these training programs and how long and how, how much is included in the training. The entire process of training is left to the hospitals, and we are just suggesting, not suggesting, mandating that they do have a program. Through you, Mr. Speaker.
Representative Serra.
Yeah, what the Aging Committee and this amendment does is, quite frankly, the bottom line is that this be added to the curriculum of hospital training, and it is left up to the hospital. But if this passes, this legislation is going to requiring that some type of training be given in hospitals. And it's really left up to them. But we want this area of dementia to be discussed with the staff and recognize this among their patients.
Representative Srinivasan.
Thank you, Mr. Speaker. I don't want to thank the good chairman for his answers, because that is exactly what I think we should be doing, the hospitals, directing them, mandating them to provide the training, but then not handcuffing them and saying, this many hours you need to provide, this frequently you need to provide, and leave it to the hospitals, obviously with the best interest of their staff and their patients, for each hospital to come up with their own plan, how best they can do an in-service as far as the training of dementia, early detection of dementia is concerned. So on the one hand, it is a mandate, but on the other hand, it is a loose mandate where we allow the hospitals, give them the authority to go ahead and conduct these training programs. So if you look at it that way, Mr. Speaker, it is a win-win situation where it is, on the one hand, we're requiring them to do that, but at the same time, we are not forcing them that this is the protocol you need to follow. And through you, Mr. Speaker, just one more question to the good chairman for my clarification. Line 6, direct care to patients, line 6 and line 7. If you can just get for legislative intent as to who these direct care people are in a hospital setting to patients. Through you, Mr. Speaker.
Representative Sarah.
Well, I think the good doctor knows I'm not sure. I'm not on the hospital staff and I'm not a physician, but I would assume just with this writing here that it's staff people within a hospital who have direct care to patients should at least have some training in this area so they can recognize the early signs of dementia as they're asking patients different questions and be able to detect that there's some early signs there. I'm assuming that that's what we mean by staff who provides direct care.
Representative Srinivasan.
Through you, Mr. Speaker, I definitely understand any healthcare provider, be it a physician, be it an APRN, or anybody else who provides medical service would be included in this program. The nursing staff definitely would be included in the program as well because they are hands-on as far as patients are concerned, and they also need to be trained in early detection. But through you, Mr. Speaker, I just want to make sure that the other ancillary people who work in a hospital system do have contact with the patient one way or the other. Let's say, for example, a radiology technician, who does come in contact, going through the procedures, or somebody who does, all kinds of blood drawing, in those situations, people who are in contact but not directly giving care in as much as would not be necessary for them to be in this training program as well. Through you, Mr. Speaker.
Representative Sarah.
Well, in my opinion, it depends. The doctor described people who have maybe daily contact with, but if you're going to have blood drawn or you're going to have x-rays, and they have to talk to the patient prior to, I think that they should have some training to be able to recognize that that patient is understanding what they're asking. So maybe they don't get training as much as a nurse who sees a patient every day, but even people who are getting blood drawn and the hypotenuse has to ask questions, that they get some answers. So I think the training will depend on the hospital and at what level they want to train the various staff members in terms of recognizing dementia.
Representative Srinivasan.
Through you, Mr. Speaker, when this bill came in front of Public Health, when it was referred to us, we in our caucus had difficulty with this bill based on this direct care to patients. So that was what we were not able to glean, who all would be included in this training program. So that's where I have some difficulty. This is a good concept. It is definitely we need. I will be supporting the amendment because overall it is a very good concept and we need to do that. But I think we should, I'm not sure whether we as a legislature are giving a laundry list to the hospital of who should be included in this program. Or once again, like we said, the hospital will decide how often to train, what the training material should be. Would we be then letting the hospitals decide as to who all need to be trained as well? In that case, obviously, we are suggesting the hospital that this needs to be provided. but we're leaving the hospital to decide on the frequency, on the training material, and who all need to be trained as well. Through you, Mr. Speaker, so that is the part that I think if we make it clear that the hospital will be able to decide all of that, that was where we had the difficulty, as I said earlier, in our caucus. And as I'm speaking here and flushing out this bill, I think if you can, through you, Mr. Speaker, to the good chairman of the Aging Committee, is that the intent of the bill, that the people who come in direct contact will also be decided by the hospital? Through you, Mr. Speaker.
Representative Sarah.
The description that the doctor just provided is correct, and I agree with you, Doctor.
Thank you, Mr. Speaker, and I want to thank the good chairman for his answers. Thank you.
Thank you, sir.